We have often heard of a mind-body connection, but what about a heart-mouth connection? Dr. Jason Stoner with Stoner Periodontic Specialist joins me today to talk about the idea that gum disease can lead to heart problems, a very serious issue. So thanks for being here with us, Dr. Stoner.
Thank you very much. Thank you.
So over the past couple of decades, really, there's been a lot of research into gum disease. So can you kind of tell us how it's being linked into cardiovascular disease?
Absolutely. So we've always known that the connection, the total body health is related to oral health, as the mouth is sort of the gateway to health of your body. So we get nutrition and everything through the mouth, and so it plays an important role in systemic health. What we've found is that bacteria from your mouth, especially if you have gum disease, and you can get this just from brushing your teeth, floats in your body, gets in your bloodstream after brushing or flossing or anything, and gets in your bloodstream. It floats around. It causes inflammation in your body, which makes small holes in your blood vessels. And so these bacteria embed in your blood vessel walls and form plaques. And these plaques are what cause coronary heart disease.
Okay, so it's some serious stuff, and it all starts in the mouth, as you said. And I always find it surprising how many people have gum disease, which you've talked about before. It affects some 80% of people. So what exactly is gum disease for somebody out there?
Yes, gum disease is the most prevalent disease in the United States, actually. It is where gum and bone and the supporting structures of your teeth, your periodontal ligament, are lost around your teeth. It's a bacterial process, and it's how your body reacts to this bacteria that causes this gum and bone loss.
So as you get that bacteria, that's what you're saying is really the main cause of that systemic issue that can go into your heart, right?
Correct. As it gets into your bloodstream, it clumps with your immune system, immune cells, and forms a glob that floats down the river, so to speak, and it gets caught on the river banks, and that eventually closes your blood vessel and can initiate a heart attack, or these plaques can break away, like the widowmaker in the heart. That coronary blood vessel will, if a plaque breaks through, it can cause a heart attack because it gets caught somewhere down the road.
Let's talk signs and symptoms of gum disease, because it affects so many people, and I'm imagining a lot of people don't even realize they have it. Maybe they skipped the dentist instead of going every 6 months or so, and they're having some symptoms. What should they look out for?
Some things to look for gum disease are red, swollen gums, bleeding with flossing or brushing, which is not normal. If you have loose teeth, if you have recession where root is exposed, or if it's uncomfortable chewing, or if a tooth just falls out, those are all signs of gum disease.
Now, I know there is kind of a growing collaboration as well. I want to talk about this between dentists, periodontists like yourself, and cardiologists because of this link.
Yes, and physicians in general, because gum disease has been linked to many different health issues: diabetes, erectile dysfunction, preterm low birth weight babies. But cardiologists are starting to work closely with periodontists and dentists in looking at the oral health so that we can tackle this problem together. And we've found that the worse the gum disease is, the worse the plaque is in your arteries. And so by controlling the oral part of it, we can also help the cardiologist with their position.
And that's smart. It's smart to work together as a team, obviously. And what are some of the ways that you treat gum disease at your office?
We treat gum disease in a more non-traditional fashion. Our office is more focused on less invasive treatments. We use a lot of laser therapy for our treatments, which is non-surgical. You don't have stitches, you don't have scalpels. It's very comfortable. So that's a main way we tackle gum disease. We also use materials that don't require second surgery sites. So we can use we can use materials that come from your blood, for instance. We take blood growth factors from you to help rebuild areas, and we can use allografts, which are collagen and materials from other humans or animals, and use that instead of using your own tissue. It makes it much more comfortable to fix these areas.
All right, so no reason to be afraid. Go in, get your gums checked. Obviously, you have 3 locations. We're going to put those up on the screen. 3 locations in Columbus, I should add,
yes.
and 1 in Springfield. So if somebody is interested, they can give your office a call, any of the offices, and set up an appointment.
Thank you so much.
Thanks, Dr. Stoner.